Good morning, my name is Catherine Leibarden, and I'm the president of AFSCME, Local 3299, representing frontline patient care and service workers at the University of California. Picking up from where Charlie left off, I'd like to take this moment to review and reflect on the burden, the task that Secretary Napolitano will have to take on when she becomes President Napolitano. And that I think it will take all of us to come to the table to fix. In review, since 2008, we have seen a $100 million increase in annual executive payroll, $300,000 per year pensions for UC's highest paid employees, subsidized by low-wage workers, students, patients, and taxpayers. UC managers and executive staff grew at 3 times the rate of nurses and almost 4 times the rate of frontline patient care workers. We've seen a 20% decline in in-state enrollment and a doubling of out-of-state enrollment. We've seen a skyrocketing tuition and graduate program fees. UC's debt burden has doubled to more than $14 billion. Tens of millions of dollars wasted on reckless Wall Street derivative investments, and thank you very much for your research, Charlie. Thousands of layoffs, reductions in course offerings and student services. Chronic understaffing, despite billions in profits at taxpayer-subsidized UC teaching hospitals, and yesterday we reviewed the dire consequences of that, specifically at Hillcrest Hospital. We've seen immediate jeopardy findings, lagging patient satisfaction, substandard patient safety ratings, preventable deaths, and to quote Vice President Jack Stobo, a clinical care enterprise that, quote, doesn't do so well. Growing privatization of public university research, open hostility towards the workers at the backbone of the UC system, thousands of whom qualify for some form of public assistance. Now, Mr. Udoff will claim that this was all somehow out of his control, that state budget cuts, which comprise around 10% of UC's total budget, gave UC no choice but to raid the pockets of its students, patients, its lowest wage workers, and California taxpayers. Seriously? Then explain to California taxpayers why executive payroll increased so dramatically these past 5 years. Explain why we are paying $300,000 to public employee pensions to President Udoff's pension at a time our hospitals and campuses are so dangerously understaffed and our kids, my kids, are being priced out of college. Yesterday, this body voted to once again raise fees on graduate student nurses, and you endorsed the idea of forcing low-wage workers to pay for these oversized executive entitlements. Thank you.
Thank you.
California is watching to see if now we can begin to get our priorities straight.
And I want to comment on, in opposition to the increased PDST rates for graduate nursing students at UC, and how these policies will negatively affect the implementation of the Affordable Care Act. Nurse practitioners and graduate trained nurses fill crucial roles in as primary care providers in medically underserved communities. However, oftentimes these positions pay significantly less than what an RN can make with a few years of experience. The debt loads taken on to pursue graduate nursing education forces nurses to seek high-paying jobs in richer communities in order to pay back this debt, instead of serving these important roles as primary care providers in the community.
I apologize for my casual attire, but I just got off working a 12-hour shift. I work a full-time night shift at San Francisco General in a somewhat weak attempt to pay my UCSF tuition. I'm here today because I'd like to express my concern regarding the tuition increases for our nursing master's students. Of the 234,000 University of California students, you've chosen to single out 800 students who are trying to gain further education and improve the health of their communities and their states. It's really not about the money, about the tuition increase, but rather about the message that you're sending through increasing the tuition. You're sending the message that you undervalue nursing education, and specifically nursing graduate education. And what I find disturbing about this is where the University of California leads, others will follow. So, thank you for your time.
Hi, my name is Wayne. Good morning to all the Regents. And I have a little bit different perspective to offer as son of someone who did animal research for many, many years and recently retired. Remember my dad used to bring home pictures of animals, dogs and cats, mice and rats that have been genetically manipulated, have been caged in dark cages, and were so debilitated psychologically and physically they could not stand up. And I remember as a kid looking into the eyes of some of these animals and looking into these pictures. And, you know, my dad grew up killing animals with his own hands. I grew up in a culture where we look at animals like dogs and cats and see them as our own family members. And I was horrified and mortified. And I think it's important for all of us to remember. 50 years ago, we experimented on racial minorities. We experimented on disabled children on the grounds that they were different from us.
My name is Chris Van Breen. I'd like to thank the Regents for listening to all of us today. So, in general, my perspective with overall justice and oppression is that oppression is always wrong. It's always a group in power saying you're not in power and you're different from us, therefore we can oppress you. And with the animals in the vivisection, or the animals we wear, the animals we eat, we're just saying you're different than us, therefore we can do whatever we want to you. We have power over you, therefore we can do whatever we want to you. What goes on with vivisection, you actually have power to stop. You can do this.